The documents launched by the World Health Organization seek to guide policymakers in fulfilling commitments to reduce greenhouse gas emissions and limit global warming. They call for health factors to be included in the nationally determined contributions of countries. NDCs are designed to embody efforts by each country to reduce national emissions and adapt to the impacts of climate change.
We must address health as a fundamental part of our climate response to prevent these cascading effects. This report that is being released is a call to action from the 100 organizations, 300 experts who represent billions around the world, who work alongside the WHO. And our message is clear. Health is non-negotiable. There are clear steps that we can take to respond, which are win-win. First, we must move from our dependence on fossil fuels towards a just transition. It is costing us dollars, lives, and security every day. Second, as you heard, health must be fully integrated into climate negotiations, not just because poor health cuts across sectors, but because strong, resilient health systems are vital for economic stability, national security, and prosperity.
The UN says the health and associated economic benefits of climate resilience and mitigation far outweigh the investment needed to put them in place. With the right policies in place and a real determination to meet targets, there's also a chance lives can be saved.
So although the nationally determined contributions are effectively a promise that countries are making on behalf of their populations, the world population and future generations, of what they will do to combat the climate crisis, they're also effectively a contribution that they're making in order to protect the health of their own populations. Because as Maria has outlined, the actions that need to be taken in order to stabilize carbon emissions and stabilize levels of greenhouse gases in the atmosphere, if we do them right, are a huge public health opportunity. If we were to meet the Paris Agreement goals, we would save somewhere in the region of 1 million lives a year from reduced air pollution alone.
According to the WHO, by thinking of the health benefits that can come from reducing emissions and the impact of climate change, countries can start having much healthier populations, both physically and mentally.
Health is the life experience of climate change. If you want to put a face to climate change, put a human face. Think about lungs, think about our cardiovascular system, think about the way infectious, vector-borne, all type of diseases, displacement, massive mental health problems as well, and diseases that we can prevent if we take action on climate change.
Meanwhile, the WHO says prioritizing public transportation and human-powered vehicles will not just reduce emissions, but also bring the health benefits of daily exercise. Green spaces in cities can improve air quality, provide space for physical activity, enhance mental health, and help to cool urban areas. Nick Mudimba, CGTN, Nairobi, Kenya.